Hello, welcome to Adapt NCLEX and thank you for joining the channel. I'm beginning a series where we'll be discussing must-know medications for the NCLEX. This is how you can simplify pharmacology. And I'm going to use SATA questions and show you the prioritization for each of these medications. We take some few medications using the pillars of NCLEX, and then we discuss some of the prioritization questions or most important thing about that medication in the SATA form. That means you have to know everything, and I will show you which one is the most prioritized information for that medication. So if you know that every time they ask you a question on that medication, you'll be able to answer that. And so let's get to it. And before that, I'd like to invite you to join us every Saturday. And so today, this first series, we'll be looking at a couple of medications, drugs that you have to know. You have to know this one. So let's get to it without wasting time. So this is the question that we have. So for Adapt NCLEX way, whenever you see a set of question, just briefly, the way we do that is to read the last portion of the question to find what is being asked. Okay, then you read the rest of the case to find the case. Then as you read the case, look for your buzzwords. These are words that when you hear it, you know they're talking about something. Then you rewrite those buzzwords to analyze your content. And when you come up with the content, you use it as a bag containing information, and you take it with you to answer the choice, making a choice, and then you move on. When you're doing that, you look at each answer choice independent from the other. Don't compare, start from the top and make a decision. No matter what, don't move until you make a decision and don't come back to it. And then you keep on going, attacking each one using your content. That is the way to do it. You can start from below, it's fine. But this is the best way to answer these questions. It makes you focus and you move on. So what do we have? It's a select or apply SATA question. Which of the following statements need intervention? So there's something patient is saying that I need intervention. I've not even read the first portion of the question, but I know I have to intervene. So my ask is to intervene. A client with type 2 diabetes was prescribed metformin due to compliance issues. Which of the following statements need intervention? So the case in a simple form, patient is type 2 diabetes and it's on metformin. That's all. What are my buzzwords? It's the same thing. Type 2 diabetes and metformin. And then rewrite, yeah, that's where I'll come in with my content. And you tell yourself, metformin is a special drug used in type 2 diabetes because of certain things that you need to know about it. And you come up with your content. It doesn't stimulate insulin secretion. It makes the individual cells to be sensitive to insulin. So they improved what we call insulin resistance. And that is what the problem of type 2 diabetes people. They have insulin resistant, but this improves it. So it doesn't secrete anything about insulin. So it doesn't affect the pancreas. Because of that, metformin doesn't cause any weight gain issue. There's no weight gain issue here because there's no insulin being released by metformin. It just increases the sensitivity. All the diabetes medication that stimulate insulin production, like sulfonylureas, yes, those one will cause a weight gain issue. But this one does not. So which of the following statements need intervention? I'm not going to have a weight gain issue because metformin doesn't do that. So I need to intervene. Okay, to have CT scan with contrast while on this medication. No, when you're taking metformin, you cannot have contrast medication. So you got to stop the medication 48 hours before the contrast. They give you fluid, and then after the CT scan with contrast, you wait another 48 hours to resume the medication. So 1 to 2 days before the you got to hold it before the CT scan, and after the CT scan, hold it 1 to 2 days. Why? Because it leads to lactic acidosis. That is a metabolic acidosis, which is your body doesn't like it. And so because of that, this question is not okay. It's not okay to have CT contrast while on this medication. So we get into it. Risks of hypoglycemia. This is the same thing. The metformin doesn't affect insulin released. It just improved insulin resistance. If I'm not releasing insulin, I'm not going to cause my glucose to go into the cell and decrease glucose level. I will just improve their sensitivity. So even though you're improving it, it doesn't rush all the glucose into the cell. So this is a concept you have to know. Metformin has a very low risk of hypoglycemia. Therefore, I need to intervene here. Good for the elderly. Yes, because of this, if I'm not going to cause hypoglycemia, then it's good for the elderly because they are the one who usually, when they take sulfonylurea, they are more risks of getting hypoglycemia. Therefore, this is good for the elderly. You don't need to intervene. It causes metabolic acidosis. It's not it causes lactic acidosis, and lactic acidosis is the same as, it's a form of metabolic acidosis. Therefore, I don't need to intervene. The patient know what they're talking about. So the one you need to intervene is weight gain issue. It's not okay to stop, take it while you're getting CT scan with contrast. There is no risk of hypoglycemia. It's good for the elderly, and it causes metabolic acidosis. If you know all these things, information about metformin, there's no question they will ask you that you don't know. Then, if they ask you about priority action for this medication, what is the priority teaching? Priority teaching is to stop the medication 48 hours before a CT scan and wait another 48 hours before initiating the CT scan with contrast. This is one of the priority actions because all this, if you hold it 48 hours, it prevents lactic acidosis, which is the most serious one. So it's all come down to this, holding it 48 hours before. So that's the priority teaching. If they ask you which one is the priority teaching for any patient on metformin, I need to tell you to hold those medications 48 hours before CT scan and wait 48 hours after that. So that is the first drug. We finish with there's no question that it will ask you in the board that information is not here. Second drug that you must know for your test. Select all that apply. Which of the following teaching is appropriate? Okay, I have to do the right teaching. A client with chronic kidney disease was prescribed Epoetin alpha. So which of this teaching is appropriate? Patient, your content. So we know our acts teaching K is kidney disease with who need Epoetin alpha. And the buzzword is kidney disease, okay? Need Epoetin alpha. Then you tell yourself, kidney disease, chronic one, they lack so many things. You usually secrete epotropin. Epoetin alpha mostly is made by the kidney. Kidney is where you secrete it, and it causes the bone marrow to make more red blood cells. And therefore, any patient that has a chronic kidney disease, they have chronic anemia. Why? Because they lack Epoetin alpha. So we give this to them to improve their anemia. You don't need it to go to 15 hemoglobin. No, just a little 1 gram is enough. That is the key. If you're giving this medication to somebody who is on chemotherapy, myelodysplastic disease, or so chemotherapy, you can also give it to somebody chemotherapy where the bone marrow is destroyed, or myelodysplastic, we call it myelodysplastic disease. You have to know you don't need to get the hemoglobin to 15, 13, just 1 gram alone, only 1 gram. Increase it to 1 gram in the patient per deciliter, and the patient will be fine. The same thing for kidney disease. So we just need to give it to them because they cannot make it. That is the key. So hold the medication if hematocrit go up above 12. This is too much. When we're giving patient Epoetin for chronic kidney disease, we do it when their hemoglobin is less than 10 grams. So when it's less than 10 grams, you start it. As soon as it's more than 11 grams, these numbers are very important. 11 grams per deciliter, you stop it. You just need it to 1 gram. 12 grams a day, deciliter is too high. You've gone up too high because this medication is dangerous. Therefore, which intervention, which teaching is appropriate? This teaching is not appropriate. Okay, so we don't need to do this because you've gone above 11. You just need to increase it to 1 gram, since you usually initiate it when it's less than 10. So you don't need to go up above 11. As soon as you get to 11, yes, going 12 is too much. So if you're greater than 11 grams per deciliter, yes, that's fine. You can stop it. But if you go above 12, yeah, that's too long, too high. It's a problem. How do you give this medication? You can give it through IV and sub-Q. Therefore, administered by IV, yeah, it's very good. Need a prescription for hypertension? Well, when you're on this medication, your blood cell is going to go up. RBC goes up because you're stimulating production of that. What happens? If I stimulate this, I'm going to increase my hematocrit. When you increase your hematocrit, what do you think will happen? Patient develop polycythemia vera because the blood is now very, very thick. And what happens? Thick blood, you increase their blood pressure. So hypertension is the #1 priority side effect for this medication. Whenever you see hypertension, patient is going to get stroke. It's going to get thrombosis, PE, pulmonary embolism. Is going to get MI. You don't want them to get there. Any signs of hypertension, that means you've increased too much of the blood volume. You need to intervene. I don't need a prescription for blood pressure medication. It means I'm getting side effect for that medication. So this is a bad teaching. It's a bad teaching. This is your priority action. When you see hypertension, stop the medication right away because then the patient is going to stroke, have a PE or MI. Avoid fresh vegetables. Well, Epoetin is a trick. It doesn't stimulate production, or it doesn't lower your immune system. There's no way to do that. Okay, the people who take Epoetin, even though they may be immunocompromised, this patient is a kidney disease patient. They are not immunocompromised. If they give you somebody who is even myelodysplastic or somebody on chemotherapy and you're giving them Epoetin, even though they should avoid fresh vegetables because of immunocompromise, that is not related to the Epoetin. It may be related to the neutropenic precaution that patient need to take, but it has nothing to do with the Epoetins. So therefore, this is not appropriate teaching. Administer via sub-Q. I told you, so that's the way. So you take it IV or sub-Q. Polycythemia vera is common. Yes, the blood gets thicker, and they have hematocrit goes up, and they have polycythemia vera. So this is it. So teaching that is appropriate, administered by IV or sub-Q, and polycythemia is common. You don't hold the medication when the hemoglobin is greater than 12 grams. It's when it's greater than 11. That's where you stop it. And then you don't give the patient prescription for hypertension. No. When you see hypertension, that means they're about to stroke. You should stop the medication. They then need to avoid fresh vegetables because it's not used to improve patient neutropenic state. It's just for anemic state. And those are the key facts about this medication. Those are the key facts. And the priority action, like I said, is hypertension. When you see hypertension, this is your priority action. Okay. We move on. Number 3, medication that you must know for your exams is a SATA form. Which of the following teaching is appropriate? The same thing, appropriate teaching. A client with a known chronic heart failure was placed on furosemide due to recurrent exacerbation. So you have had, so our ask is patient, what teaching is appropriate. That's all, right? And then what is the case? Patient has heart failure, okay, and is placed on furosemide. Which teaching is appropriate? So buzzwords, furosemide, and teaching being appropriate. That's all. And then your rewrite is the same thing. I'm dealing with furosemide. What teaching about this medication is appropriate? And before you answer that, you come out with your content. You say furosemide is what? It's a loop diuretic. So it's a loop diuretic. What does it cause? Main side effect, hypokalemia. It's side effect. That's my priority action. And the other side effect is a sulfur drug. Okay? If it's a sulfur drug, it causes photosensitivity and Stevens-Johnson syndrome. This is also your other priority action, these two, hypokalemia and being a sulfur drug. We're going to look at these answer choices and then we'll break it down. This content is enough. Wear a sunscreen during outdoor activity. Yes, photosensitivity. You can teach them to wear a sunscreen, wear a long sleeves so that they don't and bend themselves up. And therefore, this teaching is appropriate, but it's not a priority teaching. Avoid banana. The medication causes hypokalemia. Banana improve your potassium. You should let them take some banana to improve their potassium because hypokalemia is a B-sharp moment. When you have hypokalemia, that's a cardiac issue. So whenever they give you furosemide, looking for hypokalemia signs and then sulfur drug signs, those are the main things you should worry about. So avoid banana. It's not the appropriate teaching. That's wrong. Small purple rash on the chest is normal. Guess what? This is the Stevens-Johnson syndrome. They have a small purple rash on their chest. If you don't do anything about it, the rash spread is all over their body and the skin peels. They get dehydrated, they become septic, and they die. So Stevens-Johnson syndrome is a serious problem with Lasix because it's a sulfur drug. Every sulfur drug have that problem. Therefore, a small purple rash on the chest is not normal. You got to tell them, call me as soon as possible. So this teaching is not appropriate. Call provider with a muscle cramp. Yes, your examiners try to hide it. Muscle cramp is due to hypokalemia. So they will not tell you hypokalemia, but they'll give you signs and symptoms. Patient has muscle cramp, therefore they have hypokalemia. Thus, teaching is appropriate. they start having ringing in their ear, it's not going to go away. That can lead to permanent ear damage. When they start having ringing in their ear, you call them and you said, no, that's not appropriate. It's not going to go away. We got to come in and then teach you to stop the medication. It usually happens when you're giving the medication by IV and it's going too fast. So you need to stop the medication. It's not going to go away. Rise up slowly from a sitting position to a standing position. Yeah, this is appropriate. They will be hypotensive and you have orthostatic hypotension. Therefore, this is an appropriate teaching. Therefore, what is the problem? Wearing a sunscreen during outdoor activities is good. Avoiding banana is not good. Small purple rash on the chest is normal. It's not good. Call provider with muscle cramp is a good teaching. Ringing in the ear will go away. It's not appropriate teaching. Rise up slowly from a sitting position to a standing position is a good teaching problem. When they are ringing in their ear, you need to let them know, or if they are in the hospital, slow down the infusion. This will not go away. It will cause a permanent hearing damage. So you got to intervene. Purple rash on their chest, no, that is Stevens-Johnson syndrome. So for furosemide, watch for hypokalemia as your number one, then Stevens-Johnson syndrome as your priority action for this medication. Then our number 4, and that's my favorite. So, SATA form. Which of the following require immediate intervention by the charge nurse? A client with cirrhosis developed acute hepatic encephalopathy. Lactulose was prescribed. Which of the following require immediate intervention? So the case, somebody, our ask is you got to intervene. The case, somebody with hepatic encephalopathy was placed on lactulose. So the buzzwords are lactulose, hepatic encephalopathy, and immediate intervention. So your content, you say yourself. Patient with cirrhosis, the liver is responsible for breaking down ammonia, okay, or all chemicals. I call it detoxification of chemicals. If you have liver injury, your ammonia buildup. If you can't get rid of it, it affects your brain and you get what we call encephalopathy. It's a fancy word. That means you're confused. You don't know where you are. If we don't treat it, you go into coma. The early signs is flapping tremors, which is hysteresis. So when you see it, you worry about it. You give them something that can take away the ammonia, and that is lactulose. That is the most common medication that we use. Sometimes you can use rifaximin, that will help with the same thing, but lactulose is the common. It's a laxative, so you got to think about all those contents. Now, let's go look at the question. Answer choice. Check for flapping tremor. Do I need to intervene when I know that the patient is having encephalopathy and I'm looking for tremors? No, I'm looking for hysteresis and make sure their disease is not progressing, the lactulose is working. I don't need to intervene here. There's no need for you to intervene if you're checking for flapping tremor. There's no need at all. That's a good thing to do. That is hysteresis. So that's what you look for. If they ask you for assessment finding, I would do flappy tremor. So the charge doesn't need to intervene. Administer medication rectally and orally. That is the form where we give it. We give it orally or rectally. Those are the two forms we can give lactulose. Give medication with milk, fruit juice. Yes, so there's two, it doesn't taste good. So patient don't like it. The only thing that is allowed is milk, fruit juice, or empty stomach. This is the way to give it. So I administer the medication rectally. Well, no intervention. Give the medication with milk and fruit juice. I don't need to intervene. Like I said, milk, fruit juice, or empty stomach. Titrate to 3 to 4 bar movement. What this means is patient has hepatic encephalopathy, and you're treating with lactulose. How would you know lactulose? That's another question. Is effective. The other way they would say is therapeutic effect of the medication. You can't just give them the medication and just go away. You have to look for signs or look for something to tell you your medication is working. You want to titrate it to 2 to 3 bar movement. You should not go above that. If you go above 3 bar movement, they were going to have side effect of the medication. It become excessive. Therefore, your goal, this is very important. Check for 2 to 3 bar movement. Going above 3 to 4 is wrong. So if the nurse is titrating to 3 to 4, even though it's just 1 point, it's a big deal. So 3 to 4 bar movement is bad. We want to get 2 to 3 bar movement. You have to know this. I need to intervene. Monitor for ammonia level. Yes, the ammonia is high. I give them lactulose. I have to assess the effectiveness of my medication. And the way to do that is to check for 2 to 3 bar movement, check for hysteresis, and check for the ammonia. This will go down. If it's 200, it will be like 50. So I need to check this. So I don't need to intervene here. Monitor for potassium. Lactulose, like I told you, is a laxative. Every laxative will decrease your potassium and increase your sodium. Mostly lactulose, this is what you do. It decreases your potassium. Why? When you have diarrhea, potassium decreases. So diarrhea will cause a decrease in potassium. Therefore, I should monitor their potassium. Therefore, I don't need to intervene. So the only thing that needs intervention is by titrating it to 3 to 4 bar movement. We want to get it to 2 to 3 bar movement. Checking for flappy tremor is good. Administering the medication rectally, orally is good. Give it with milk, fruit juice, or on empty stomach is good. I need to monitor the ammonia is good. And then monitor the potassium is good. So what is your priority action for this medication? Is the titration. Titration is key. I don't want you to get to 2 and 3 bar movement. 2 to 3 bar movement, that means I'm doing a therapeutic effect. This is where I want to get you to. So this is a priority action for lactulose. We want to get you to 2 to 3 bar movement. That's the most important aspect of it. I know you can monitor for potassium, but usually it's a secondary effect. The main thing is if they're going more than 2 to 3 bar movement, get worse. The potassium goes down. So is the high level of bar movement or multiple bar movement that causes the potassium. Therefore, my priority action is 2 to 3 bar movement for lactulose. So that's for that question. And then finally, we have the last medication that you have to know. Which of the following requires a priority teaching and intervention? So you have to do 2 things. One of them requires priority teaching, and you have to intervene. A client was prescribed carbamazepine for intractable trigeminal neuralgia. Which of the following require priority teaching? Guess what? In pharmacology, they always will tell you, with different kind of question, they give you the medication and they tell you what it's used for. I've told you what is medication, carbamazepine, and I've told you what you use for. The other way, they'll give you the problem and they ask you which medication we use. For this series, I'm giving you the medication and what it's used for, and you got to tell me what is the priority action or everything you need to know about that medication. So we have carbamazepine that is used for trigeminal neuralgia. That's the most important medication you have to give to these patients. You can give them all pain medication, but carbamazepine is the effective medication to use. Carbamazepine is a seizure medication, okay? It's used for seizures, okay? But it has also good effect in pain management, as you can see. And guess what? There's certain side effects you might know. And then what I want you to pay attention to is two. It's a sulfur drug, and it causes agranulocytosis. That's the two things. If you don't know anything about carbamazepine, is what you need to know. These are the two. Sulfur drug, it causes photosensitivity. And secondly, it causes Stevens-Johnson syndrome. This is dangerous. Photosensitivity is not. So priority action, Stevens-Johnson syndrome. Secondly, agranulocytosis. This is also dangerous. That's B-sharp moment. So he has a B-sharp here, he has a B-sharp here. Agranulocytosis, that means you lower your neutrophil level. So your ANC, absolute neutrophil count, goes down, which is not good. So the individual is at risk of infection. So two things about it, if you don't know at all. Sulfur drug will lead to photosensitivity and Stevens-Johnson, with Stevens-Johnson being important, and agranulocytosis, which can lead to infection. Therefore, you go back and you look at your answer choice. Wear sunscreen during outdoor. Yes. It's a teaching that is appropriate, right? I wear sunscreen, but is it a priority teaching? Not really. But it's a teaching that you can give the patient that to know about. Okay. So that's not a priority teaching, and I don't need to intervene. It's a very simple teaching, but it's not too much a priority. Priority teaching is something that is going to cure the patient. See a dermatologist for a small purple rash on the chest. Yes, this is a priority teaching that you have to know, because then they develop Stevens-Johnson syndrome. Therefore, I will go with this. Decongestant for runny nose. If they have a runny nose, that means they have an infection. If they have an infection, then you have to worry about it. They may be, that's agranulocytosis. Any signs of infection, runny nose, fever, 100, diarrhea, anything like that tell you the patient is earlier sign of infection, you need to intervene. Don't go and take medication to stop your runny nose. I need to intervene. So this is an intervention portion of the question. So we need to intervene. You can't do that. You're going to die because of agranulocytosis. Frequent lab check. Yes, this is a priority teaching. We got to check your lab to prevent agranulocytosis. Neutropenic precaution. Yes, you are high risk of infection because of agranulocytosis. Therefore, I need to let you know that we got to give you some precaution to prevent you from getting infection. And neutropenic precaution is something you have to know for patients who are high risk of infection. It's the same thing, okay? You can't do garden, okay? That's not good. Okay, fresh vegetables, no, you can't do that. You got to wash it. You can't go to hot dog and stand and get a hot dog. No. Okay, you got to, when you go out, you can't drink from the fountain water because you're going to have infection. All these things, you don't let them go too much outdoor, where there's gathering, where they are immunocompromised, yeah, because of the risk of infection. So you got to teach them all these things to let them know. Therefore, Neutropenic precaution is very good. Frequent lab check is also very good. Priority, the answer said priority. Decongestant for runny nose, no, that's a priority intervention. I got to intervene. See a dermatologist for a small purple rash, no. Priority intervention, so that's intervention. This is intervention. This is intervention. This is teaching, and this is teaching. Wearing sunscreen is consistent with carbamazepine because it's a photosensitivity, but photosensitivity is not a priority problem. You can let them know about it. It's not your priority. What you have to pay attention that will cure the patient. Therefore, no. Once again, priority action, agranulocytosis, and sulfur drug causing Stevens-Johnson syndrome. This is Stevens-Johnson syndrome. And this is the end of this first series where we talk about big medications that you have to know when you wake up in the morning and I tell you what is metformin, you should be able to tell me key 2-3 things about it. If I tell you carbamazepine, what do you know? Priority actions. Those side effects should just come out from your mind. If I give you furosemide, key things, hypokalemia, and sulfur drug. Those are the way when you're waking up and you go about, you're getting closer to your exams. Those are the things. You mention a medication. Oh, I know these 2 things. That is what your board is going to ask you because that's what they care about. And that's the priority action. We're not going to ask you a secondary questions that is irrelevant. Most important. Therefore, take care of yourself. And if you've not subscribed, subscribe to the channel and follow up with this series where we have great medications that you will learn a lot and make pharmacology easy for you with SATA, select what apply, making you comfortable to answer this question. Take care of yourself and have a good day.